and I currently work in sleep medicine at the Boise VA in Idaho. I previously, before working in sleep, I did internal medicine and primary care, so have a lot of experience with coronary artery disease. Most of my patient population was 55 and above, obviously veterans, and so a lot of metabolic syndrome, coronary artery disease, sleep issues in that population, obviously. And so now I do full-time sleep and pulmonology downtown at the Boise VA. And so I'm excited to talk about sleep health and kind of its link to just overall health. Obviously want to target coronary artery disease specifically since that's kind of the topic, but excited to talk about just sleep health in general as well, because I know it's an emerging field. I feel like people are just getting on board to really understand why sleep is so important and why it benefits our health. But I still think there's a lack of understanding about, why we need to sleep and why we need to get restorative sleep.
Wonderful, wonderful. Now, there's a caveat you said you needed to do. I want to remind you about that.
Oh, yeah, so I do have to say, because I work for the Boise VA, for the government, anything I say today is not a direct representation of where I work. It is all based on my educational background and experiences. So thank you for reminding me. I would have forgotten. So thank you. I appreciate that.
Yeah, no, it's all good. It's all good. I got to honor that because I don't want you to get in trouble.
Yeah.
So sleep, like it's something that, as we get older, I'll be 57 in April. Adrian, my partner, calls me a professional sleeper because I can hit the pillow and be gone. And it's really important. Like I said, even though I am, it doesn't necessarily mean I'm getting good quality sleep all the time. But it's definitely, there's many facets to sleep. So why don't you sort of talk us through the importance and what's going on in our body when we get good sleep and what's going on when we don't?
Yeah. So I kind of want to start it off because I don't think a lot of people realize that the majority of, people in general, specifically looking at studies based in the US, almost up to a third of, the population is not getting good sleep. So chronically sleep deprived. And we actually refer to sleep deprivation as getting less than 6 hours a night of sleep. And so if you're a parent, if you're working full time, if you're working a stressful job, a lot of people aren't getting not only enough sleep, but enough restorative sleep. So anything less than 6 hours a night, we consider sleep deprivation. And based on current recommendations for most people, we recommend at least 7 to 9 hours of sleep a night. And that is because you have multiple cycles of sleep, and while you're going through these different cycles of sleep, a ton of very vital health pieces are occurring. So, your hormones are being regulated, your immune system is being bolstered, your memory and your cognition is kind of being cleared out and then consolidated. So if you're not getting those 7 to 9 hours of sleep and you're chronically sleep deprived, it's going to impact multiple facets of your life. And I don't know where you're at, I know where I'm at, and kind of everywhere right now, there's a lot of focus on how do we optimize our productivity, how do we optimize our fitness, how do we eat right, how do we do all of these things. And some of it I feel like is at the expense of a restorative night's sleep. And there's no, you can't take a pill to compensate for the fact that you're not sleeping the amount of time and the, restorativeness that you get from sleep. So really just kind of want to hound that in first, is that probably most of us are not getting enough sleep, just to start. And I don't know, how many hours would you say you sleep on average?
Well, we usually go to bed. We're early at 9:30. And I usually wake up, I'm usually ready to get up at 5 a.m. I wake up, I don't use an alarm. So I'm getting, I think I'm getting in the right zone of sleep in terms of the number of hours that I get. And again, I can hit the pillow and be gone. I've been told mid-conversation, I was talking, all of a sudden I hear you snoring or just breathing hard. So that's why Adrian calls me a professional sleeper. I do.
Fair enough.
I believe naps are super beneficial. I have a window for naps, so I'll be like, I know my nap window's here, and if I don't get horizontal, it goes away. But I do set an alarm when I nap because I don't like waking up feeling groggy and going, where am I?
Mm-hmm.
That'll happen too, right? So.
Awesome. Would you say before your event that you were getting good night's sleep, or you were sleeping as good as you are now?
No, I'm sleeping way better now. And that's because I'm different. I've made a lot of changes. I meditate. I've got coping mechanisms for when I do struggle to fall asleep. I can, focus on a deep belly breathing technique, and then I find I just drift off. So I've got tools now that I never had before.
Okay, good. Yeah. And I think in my case, what I see is kind of similar to how you've gotten better tools. You've probably done a much better job at trying to focus on your health. I see a lot of people once they've had an event, they have either an accident at work because they weren't alert, they weren't cognitively there, or they've had a heart attack or a stroke. And so then I see them kind of after the fact. And so I love what you're doing because I think it's important that we kind of address this before somebody has a major event, before someone has a heart attack, before someone has a stroke, or even, a car accident or something that's going to be life altering. And so I'll kind of dive into the aspects of sleep. Obviously, I could go all day on different effects of sleep. The main thing I want to focus on, though, is the increased risk of heart disease and kind of the different pathways that we see that occur. So I know me and you had kind of talked last night. The first one that I want to talk about is inflammation. So when we're sleeping, our cortisol levels, which is our stress hormone, which kind of causes increased inflammation, increased stress, increased anxiety when those levels are high. That is all regulated by your sleep cycle. And so if you're getting chronic sleep deprivation, you're not sleeping well at night, or you're having what we call disruptive sleep, which means when you're falling asleep, but then you're waking up sporadically throughout the night, so you're not going into those deeper stages of sleep, so deep sleep and REM sleep, your cortisol levels will be higher. And when that stress hormone is higher, you have more inflammation in the body. Your blood pressure is going to be higher, your heart rate's going to be higher, and you're just not going to handle that variability as well. And so after 10, 15, 20 years of these elevated cortisol levels, this chronic inflammation, your risk of heart disease is going to go up. So that's one kind of aspect. Again, could dive much deeper, but that's one big aspect. Do you have any kind of questions or things to ask about that portion?
Well, again, cortisol is one of the many hormones of stress, right? Epinephrine, norepinephrine. There's a whole cascade that happens, and yeah, stress leads to dis-ease, and dis-ease leads to illness. And I use a simple term. I talked to a health coach yesterday, and we were talking about how when we're in that state of inflammation, our arteries become more like Velcro when they should be like Teflon.
So you're right. So more stress equals more sickness, more illness. And then the other hormone I kind of wanted to touch on was your hunger hormone. So again, this is kind of a chicken and the egg type scenario, right? So when you're not sleeping, the two other hormones that I see and I want to talk about today are ghrelin and leptin. So ghrelin is your hunger hormone. So, when ghrelin levels are high, you're going to be more, I guess, snacky is the way I would put it. You're going to be reaching for higher carbohydrates. You're going to be reaching for caloric dense foods. And then leptin is the I'm full hormone. And so your leptin levels actually go down when you're not sleeping or you're sleep deprived. And so that combination of increased hunger, reduced, I'm full hormone is going to cause increased cravings, increased consumption of carbohydrates, fats, salts, all foods that are not good if you have, risk factors for coronary artery disease. Because again, it's kind of like said chicken and the egg. Are you getting coronary artery disease because you're eating too much of these, I don't want to say bad foods, but these higher risk foods? You're getting more central obesity. And then because you're eating and, eating these foods, getting the central obesity, gaining weight, not exercising, it kind of has this downstream domino effect of increased risk of heart disease.
Yeah, no, it's that's something I wasn't aware of, but again, it makes a lot of sense. It makes a lot of sense that it's just there's just so many facets to sleep that I'm not aware of. I mean, I think this is why I wanted to talk with you and have you on. It's because it is something. I think it's something we need to talk more about. And again, getting that amount of sleep, the right amount of sleep, and getting quality sleep too, right? It's one thing being horizontal in bed and resting, but
Yeah.
are you actually sleeping? Are you getting into REM sleep? So maybe you want to dive into REM sleep and the importance of that.
Yeah. So, we have four stages of sleep. We have N1, N2, N3, which are non-REM, which is rapid eye movement sleep. And then we have REM sleep, which is that rapid eye movement sleep where you have this paralyzation of all of your muscles besides your diaphragm, because obviously you need to breathe while you're sleeping, and then your rapid eye movement. And deep sleep, which is N3, and then REM sleep are two of the more vital pieces of sleep, because that's where most of the hormonal regulation occurs, where immune system mediation occurs. It's also where we think you consolidate memories. And so, a lot of your memory consolidation occurs. We kind of think of it as cleaning out the brain of all of the debris during these stages. And so that way you can actually critically think the next day. You have more focus the next day. And so with REM and even deep sleep, what happens is in the initial parts of the night, you go through cycles. So from N1 to REM, it's about a 90-minute to 120-minute cycle. And we think that we know that we cycle through these multiple times a night. And so initially your deep sleep is a little bit of a bigger window and your REM sleep is a very small piece of that first cycle. But as we go deeper into the night, your deep sleep stages get smaller and then your REM stages get bigger. And this is where you're going to have more vivid dreams. You're going to be, again, have that paralyzation besides your diaphragm and your rapid eye movement. And so when you're in this REM sleep, we really think you're getting restorative sleep. The problem is that REM sleep and deep sleep is where we see a lot of disorders. So I know that we had talked a little bit about sleep apnea. So we see sleep apnea in a ton of patients. It's really common over the age of 50, especially in male patients and those with a little bit of obesity. And the problem with that is when you go into REM sleep, you have that paralyzation, your palate can collapse and actually cause this obstructive apnea, or you stop breathing and it wakes your brain up and disrupts REM. And there's other things that can disrupt REM as well, but the short of it is if you're not getting REM sleep, all of those things that I talked about are going to be disrupted. So immune system, memory, cognitive, focus the next day, all of those things are going to be disrupted with lack of REM and even deep sleep.
Yeah, sleep apnea is huge. I mean, I'm the only person in my family that doesn't have a apnea machine. My mom doesn't. My mom really needs one, but she's just resistant to it. My dad, before he passed away, had one, and yeah, your heart stops too, right? It can stop.
So your heart doesn't stop, but so what happens is when you stop breathing, that increased vascular pressure basically tells your body to go into like fight or flight mode, right? So when you stop breathing for a prolonged period of time, usually it's about 10 seconds, you have this kind of, and then you stop breathing, your heart rate goes up to pump oxygen to the brain. Your blood pressure goes up to try and again get things going, and then we call them kind of, you don't completely wake up. So people with sleep apnea, if you've ever watched someone with sleep apnea, they don't like jump out of bed and are wide awake. They stop breathing and then they kind of have that gasp to kind of restart the system. So the heart doesn't completely stop, but the blood pressure and the heart rate will drastically increase. And again, that's why over time it can be really stressful for the heart, because you have this chronic elevation of your heart rate, your blood pressure, and then you're not getting that REM sleep, because every time you go into REM, if you're having that apnea or that stop breathing event, you're kind of waking up and disrupting that REM consolidative sleep.
Yeah, it's interesting. So obesity, I know, is a big part of, I mean, it seems to be, from what I know, the more obese you are, the greater risk you are of being someone who has sleep apnea. Is that true?
Yeah, so we talked about how your palate kind of collapses, so your airway collapses with obstructive sleep apnea. Central sleep apnea is a little bit different, but with obstructive sleep apnea, the palate actually kind of collapses, and you're not getting an open airway. And so I tell patients, think about if you have a lot of neck fat or central obesity here. Obviously, you're potentially putting more pressure when you're laying flat or on your back against that airway. The other thing I see is when patients have a lot of central obesity, so when they have a really big abdomen and they're laying on their back. I hate to compare it to pregnancy, but it's kind of like you have all this weight on your chest. It's harder to kind of force air in when you're laying flat. And so obesity is one of the biggest causes of obstructive sleep apnea that we see. And honestly, with patients, I tell them if they're very, very overweight and they hate their CPAP, because most people hate wearing a CPAP. if they were to lose weight and pull some of that, obesity off the neck as well, their sleep apnea would likely improve. And I've had patients pulled off CPAP who have lost 50, 60 pounds after, a major event or something really kind of kicked them into gear.
Yeah, it's what I've understood too as well. Like I said, yeah, it is an important thing, and it is. Like I said, it's obesity. Unfortunately, we're in an obesity epidemic. I've had doctors. I used to run a diabetes conference back in Canada when I was still a drug dealer and a farmer rep, and we focused. And I had a speaker one year, an endocrinologist, and she talked about diabetes, and I love that term because not only does being obese lead to things like sleep apnea, um, it can lead to diabetes, and diabetes leads to cardiovascular disease and inflammation in our bodies and insulin resistance, and we could go into that a lot, but let's get back to sleep. And because again, it is diabetes and obesity are huge.
Well, and it's interesting you say that because with diabetes specifically, so we know that sleep deprivation and sleep apnea also increases your risk of insulin resistance. So again, we see that cortisol spike, we see that ghrelin spike, we see that leptin levels come down. We also see other hormones that kind of mediate your insulin sensitivity, so that ability to respond to sugar in the body. And so when you're chronically sleep deprived, though those hormones are out of whack, you're more likely to develop insulin resistance, which is a precursor for type 2 diabetes. And so then the problem with that is, so for my patients, it becomes this kind of endless feedback loop because they're not sleeping well. And so then they're more, they're hungrier, they're eating foods that they're trying to avoid, but they have these cravings for salts, fats, and carbs. And so then they're eating these foods, they're gaining weight around their midline, they're putting on a lot of, central and kind of obesity in general, which makes them sluggish, not want to work out, which, as you know, when you don't want to work out, you're going to gain weight, you're going to snack more, you're going to be more sedentary. And then diabetes itself can also disrupt sleep. So, impaired sugars will actually can disrupt deep and REM sleep if you have, sugar spikes in the middle of the night. And so it becomes this, just because you're sleep deprived, it can become this cascading event where if you don't get on top of it, or if you're not paying attention to it and you're not kind of watching for these small kind of signals that your body is giving you, it can really kind of roll downhill and become almost impossible to stop until you have an event and you really 180 your life. Um, so it's interesting. Yeah. So diabetes definitely and sleep deprivation also go hand in hand.
Yeah, no, it's true. Yeah, such a good topic. I'm loving where we're going with this. So you got a patient, they come to see you for, reasons of sleep, let's say sleep disorder, they've been identified. What are some tools that you can share with people that will be listening to this and seeing this, that you would typically give someone who comes in and is newly diagnosed?
So it depends on the sleep disorder. So if they're coming in and we know they have sleep apnea, so say they're coming in and they have a heart attack, or they have what we call atrial fibrillation, so their heart rhythm is out of whack. And while they were in the hospital, say they did a sleep study, or the cardiologist said we need to get a sleep apnea test because we know that untreated sleep apnea can cause these cardiac events, so we should test you. They test you, say you have sleep apnea. And for this, I won't dive too deep into the different types, or the different, mild, moderate, severe, but say you have moderate to severe. The first thing I would do is kind of address the elephant in the room, which is CPAP devices, because I'm sure you have friends and family that have, as you told me, have sleep apnea, refuse to wear a CPAP. And the first thing I would say is, let's look at your risk. Let's look at what's happened. Let's look at, what this untreated sleep apnea is causing. Tell me about your symptoms. Because most people who have untreated sleep apnea or sleep disorders will say, I don't feel good during the day. I'm always sick. I'm trying to lose weight, or I'm trying to get my health under control. I'm trying to eat right. I'm trying to exercise, but the weight doesn't seem to come off. I still feel chronically just sleep deprived. I feel like I just don't feel good. That's kind of the general patient that I would see, is someone who just doesn't feel good. And so then we talk about getting on a CPAP, which if everyone has seen a CPAP, it's the device that opens the airway, it pushes air in, and basically keeps you breathing when you stop breathing. So that way you're not being woken up from REM and deep sleep. Um, And so we would go through that. And I think that, a lot of people don't understand the effects of chronic sleep deprivation. So I really try and identify their kind of trigger points or their problem points. Because it's easier to convince people to treat something if they know that it's actually causing these things that they've been struggling with for years. So that's where I start.
Yeah, yeah, no, totally. Again, it's you got to understand the root cause, right, in order to be able to help them. And like I said, I think we're too quickly we reach for pills. There are other things that they can do, like looking at their lifestyle. Lifestyle is something that we don't talk enough about
Yes.
in Western medicine, in my opinion.
Yeah, and so with lifestyle, for if they want to avoid, like you said, medications or even a CPAP, the first things I say are, working on weight loss. And this isn't like jumping on a fad diet. You don't have to be crazy. This can be things like walking after breakfast. So we know that walking after breakfast, walking after meals, actually lowers your blood sugar, increases your metabolism, boosts your mood, does all of these good things for you. So walking after meals is one that I tell my patients. It's easy. You can do it for 5 to 10 minutes. Get your heart rate up a little bit, get things moving, get your digestion moving. That's going to help with weight loss. The other things I tell patients are, sunlight exposure for, sleep issues. So if you feel like you can't go to sleep or stay asleep, sometimes looking at, your work environment. Are you getting up before the light comes out, staying all day in an office, and then coming home in the dark and then can't fall asleep because your circadian rhythm is disrupted and you're having issues with kind of that whole sleep cascade that occurs when your circadian rhythm is out of whack.
Yeah, no, I love that. Yeah, I was just waiting for the moment to talk about that as I shared with you last night. The recent podcast with Peter Attia and Andrew Huberman. Um, in that podcast, they talk about Andrew Huberman introduces a study around um, basically our circadian rhythm, how important it is to get that early morning, sun on your eyes, like with this coming up the horizon. So it's really important if you can get out and see the sunrise. It's super important. And if you can't, because you're just so tired and you're sleeping because you're not getting great sleep, at least get out at the end of the day and try and get that light when the sun is going down. And it was, I do that. Like this morning, I literally walked out. I wanted to go for a walk around my neighborhood. I didn't have time. So I just walked out into our patio. The sun is setting just over beyond where I'm looking right now. It's all clouded in. We're kind of socked in with fog, but there's still the light I need is still coming through that cloud, even though it looks like it's not. And it's been unbelievable. Like I've been doing this now. Adrian and I, when you go for a hike, we went for a hike on Sunday, and near the end of the day, it was 5 o'clock. I said, "Hey, we should take our sunglasses off and get that light." And she calls it cirque. We got to get her cirque.
That's
So
awesome.
yeah, and it's an important thing to reset your sleep clock every day.
Well, and the newer studies that are coming out too, are like you were talking about, the reason why that sunlight is so important is because it actually regulates your melatonin. So, our bodies are trained, through evolution that when that sunlight hits the back of our eyes, the actual melatonin or the sleepy hormone that kind of is in the brain or producing, that's present will go down. So when you get early morning sunlight, melatonin production significantly drops. And there's actually some studies that show that serotonin, which is kind of that happy hormone that we all think of, actually goes up with early morning sunlight exposure. And so, we see this quite a bit in shift workers. So shift workers who are, working all night and then sleeping all day, they're at so many more increased risk for depression, anxiety, heart disease, even cancer, because their circadian rhythm is thrown for a loop. They're not getting that early morning sunrise. They're not getting that reduction in melatonin, boost in serotonin, as well as the other, good benefits that come with just being outside and being in sunlight. So absolutely, I think, morning sunlight is important. And then, with the sunshine coming down, just trying to set that circadian rhythm to help you sleep is so vital. And something easy and free to do if you live somewhere, obviously, where hopefully the sun comes out. I'm looking at Portland where the sun almost never shines up there.
Yeah, well, it's again, I mean, one of the reasons I'm in California is the sun shines a lot. It's been interesting this last little while with all of the rain and everything we had, but yeah, it's so important. It's so important, and to that point, around, getting that sunlight. There's so many positive other, effect, like just being out in the sunlight. Like we were outside. It was the first really nice day, and we're like, God, it feels so good to be out in the sun. And out on a beach, and you're in heaven, right?
Yeah.
So it's one of the things I love about people say, why are you living in California? It's like, well, there's one of
You got
right
the
there.
sunlight
Beaches,
state.
sunlight, sunlight almost year round. But yeah, it's interesting. And back to people that do shift work, like it's showing that your longevity, your lifespan is greatly reduced if you're someone who has to work shift work all the time.
Yep. And so, again, kind of going back to the increased cortisol, increased inflammation, your circadian rhythm is disrupted. You're not getting as good REM sleep. You're not getting as good deep sleep. So your hormones are out of whack. Your immune system is reduced. You have more inflammation. There have been some studies, and some of the studies that I've looked into recently, because I do have a lot of shift workers that I see, and specifically a lot of my friends who are nurses who are working night shift. There's some good studies coming out that if you can't get exposure to sunrise, light therapy is actually a first line treatment. So if you can't get natural sunlight, if you can't get it from the source, there's a lot of studies coming out that using light therapy, or like I use a sunrise alarm clock in the winter when, unfortunately Idaho has a very long and dark winter. And so I'll go to work in the, morning when the sun's not out and come home when the sun's down. So, I use that kind of simulated sunrise to try and mimic natural sunrise. So if you are a shift worker, I have strongly recommended in the past at least looking into those studies and looking into the benefits of artificial light, artificial light therapy, or those what we call SAD lamps, because there's a lot of evidence behind them, to help with shift work and to help with that disruption in your circadian rhythm. The key is when you get off from shift work, so if you get off at 7 a.m., you actually want to be donning sunglasses, donning stuff that's going to be blocking that sunlight exposure, because once that hits the back of your eyes, the melatonin is going to come down and you're going to want to be awake versus going home and going to sleep. So it's just trying to artificially create an environment that mimics the sunrise.
Yeah, and just for those that may not know what SAD is, seasonal
Yep.
affective disorder, where I come from in Canada, it's a thing. I mean, in Ontario, Canada, which is above New York, it's, you don't see a lot of sun in the winter months, and it's a thing. It really is a thing. And in that same podcast, Andrew Huberman talks about these SAD lamps. They're specifically, you turn it on in the morning. I have a light that I turn on. I get up because it's still dark out. I get into my office and I turn on this light. It basically simulates, light. So I'm getting that while I'm literally working.
Mm-hmm.
And then as soon as the sun comes up, I look out the window. Oh, it's time to get outside. I feel like amazing. I feel like a different person. I find that I wake up, I've got more energy when I do that. I'm not sitting at my desk kind of going, oh, I should have slept some more. And since I've been doing this now for a couple of weeks, I really have noticed a big difference in my energy levels.
Yeah, and we did something similar. Like I said, we use a sunrise alarm clock, so I don't use. We used to use those jarring, come on in the middle of the night. So we use a sunrise alarm clock, which actually mimics kind of the sunlight coming up. And same thing. I have noticed that, especially in the winter when it's cold and it's dark, I've noticed that I feel better, kind of coming up with a light on, shining on my face. I feel more energized. I feel more alert. I feel more focused. I feel less groggy. And then I don't know about you, but I drink less coffee. I'm drinking less, stimulants to keep myself alert because I feel like I'm waking up more refreshed.
Yeah, we've even gone as far, and I know Adrian isn't still sure about this, but in that same podcast, they talked about red light. And so I have changed out in our bedroom. We've got red lights. So when you turn the light on at night when you're going to bed, you've got this soft red light that's, you're not walking into a super bright bedroom. And, I think it's cool looking. But it's, again, I'm somebody that when I learn about these hacks, these health hacks, life hacks, I'm like, I want to try them.
Yeah.
And it's kind of who I am because I'm all about wellness now and not like I used to be about illness. It's about what can you do today, right now? What are some small incremental changes that you can do that are achievable and doable, that are going to give you a better chance of, not just living longer, but living longer well,
Mm-hmm.
happier, more vibrant. It's what I'm all about now. So
Well, and I'm glad that you're, it's so great to, have you doing podcasts like this. And I think it's so helpful because, when I work, sometimes I get to see people when they're just starting to have problems, right? But if we could educate and get information out there about small, meaningful things that people could be doing before they have a major event, we wouldn't have such a sick society, such a, unwell society. And so I think this new trend to try and make small, like you said, actionable, implementable changes that don't mean taking a bunch of medications or taking a bunch of, supplements necessarily, but easy things that you can do potentially for free, I think are great. I think the public needs to know about those things, because I'm happy to see people once they've had a heart attack, but it would be 1,000 times better if I could educate someone before they've had a heart attack, before they've had that life altering event, and steer them on a better path.
the cliche saying, an ounce of prevention is worth a pound of cure.
Yep.
So on that note, thank you so much for coming on today. What a great conversation. I knew it was going to be awesome. I love your enthusiasm, and I really appreciate you taking time out of your schedule to come on today. I hope everybody that tuned in, we had quite a few people tune in. The replay will be up shortly. So thank you for your time, Autumn. I
Yeah.
really do appreciate it. And let's do this again sometime
Yeah.
soon.
Sounds good. Thank you so much for having me on, and hope you have a great rest of your day.